Endovascular neurosurgery is a subspecialty within neurosurgery that deals with the blood vessels in the central nervous system. So that means arteries and veins in our brains and our spinal cord. And as an endovascular neurosurgeon, that's my space. So an aneurysm is a weakening or an outpouching in an artery. And aneurysms can occur in our arteries in our brain, arteries anywhere in the body. But for an endovascular neurosurgeon, we are primarily concerned with aneurysms that occur in the arteries in the brain. Several options exist for aneurysm treatment. We can do open craniotomy or open brain surgery to treat those aneurysms. But in my subspecialty of endovascular, the focus is on minimally invasive approaches to treatment of these aneurysms. So through the radial artery in our wrist or the femoral artery in our groin, we can climb up with special catheters, which are hollow tubes, and using special equipment, we are able to reach those aneurysms and treat them without ever having to cut open somebody's scalp or removing any bone from their skull. Risk factors for aneurysms are what we consider to be the top risk factors. I would say number one is uncontrolled blood pressure, and that's something that we consider to be modifiable, that people can actually control and work to bring down. History of smoking or illegal drug use, that can also cause aneurysm development. And then there's also genetics, of course. So if mom or dad or siblings have aneurysms, it is imperative for patients to get screened and make sure that they don't have one. So screening for aneurysms is very important, especially if there's a family history of aneurysm. So if mom, dad, or siblings have had any kind of aneurysm, it is important for a patient to get screened. And I think the team approach here at OU is unparalleled. And to have a supporting cast and a system that is so supportive of the physicians and has experts from every specialty really was reassuring to me, and one of the main reasons which drew me to this job. And I don't really look at it as a job. I mean, this really is a privilege and an opportunity to take care of some of the sickest folks in Oklahoma and in the surrounding states.